Welcome back. I'm opening my this one. Hope audio video everything is okay. Hope audio video everything is okay. Just send an hi message to me. Still 1 minute we have to start. Yeah. Great. Everything is okay. Perfect. Perfect. Yeah. Just a minute. Yes, great. Thank you. So, chat say hi. Great. So today is mycology. I'm starting the session exactly. Now the time is 7:01. First question: which of the following fungi is most commonly associated with the diabetic ketoacidosis? Diabetes leads to immunodeficiency. So usually diabetes, very common infection is candida usually, but when there is severe hyperglycemia, we call it as diabetic ketoacidosis, DKA. Diabetic ketoacidosis, severe hyperglycemia, the infection more common is mucormycosis. Mucormycosis, zygomycetes. They have aseptate hyphae, sometimes root-like structure present. Aseptate hyphae, vertical branching. Aseptate hyphae with vertical branching, 90-degree branching. And usually it is angio-invasive nature. Angio-invasive in nature. So it causes necrosis. People commonly call this as black fungal disease, but it is not black fungus. It's a misnomer. The word black fungus is misnomer. It produces black discoloration due to necrosis. Necrosis leads to black discoloration. Most common fellow is rhizopus. Rhizopus, here diabetic ketoacidosis, always think of rhizopus. Diabetic ketoacidosis, always think of rhizopus. Next is, which fungal pathogen is encapsulated and commonly causes meningitis in AIDS patients? Most common cause of fungal meningitis in HIV positive patients is cryptococcal meningitis. Cryptococcal meningitis caused by Cryptococcus neoformans. Cryptococcus neoformans. Cryptococcal meningitis, Cryptococcus neoformans. and it possesses polysaccharide capsule. Polysaccharide capsule. It causes a peculiar disease called European blastomycosis, skin lesions. European blastomycosis. European blastomycosis. Yes, Suman Ahmad, you are right. Answer is C. Aspergillus niger, usually septate, it's not commonly associated with meningitis, candida also. Histoplasma capsulatum, it mimics tuberculosis. No capsule. Capsulatum is a misnomer, no capsule. Other people, there is no capsule. So only capsulated fungus which causes meningitis is Cryptococcus neoformans. Next is germ tube test used for the identification of which fungus. Germ tube test used to differentiate Candida albicans with other fungus. That means Candida non-albicans. Albicans positive, non-albicans negative for GTT. That's called germ tube test. So in the germ tube test, they may ask in Viva how they are doing. They add rabbit serum. So they add rabbit serum with Candida. After 2 hours later, they see under microscope. After 2 hours later, they used to see under microscope. If they are able to see germ tube, it is positive. Germ tube is like this. If germ tube is negative, that is non-albicans. And do not forget, germ tube also positive for one more fungus called Candida dublinensis. Candida dublinensis also positive for what? Germ tube test. So germ tube test positive for both people. Then we can go for third umpire is growth at 42 degree. Which is positive for albicans, negative for dublinensis. That's all. Sometimes they may ask what is the phenomenon of germ tube. That phenomenon, production of germ tube in the presence of rabbit serum, we call it as Reynolds Broad phenomenon. That's called Reynolds Broad phenomenon. So germ tube test mainly for Candida albicans. It can differentiate albicans from other people. Other people will not produce all those things. Aspergillus flavus, Trichophyton rubrum, Dermatophyte, and Blastomyces dermatitis, which is a systemic fungus, systemic mycosis. Yes, Deepiki, great. Answer is A. Next is, which of the following fungi primarily causes lung infection and mimics tuberculosis? The fungus which mimics tuberculosis, no second thought, you can go for Histoplasma capsulatum. It is basically dimorphic fungi. Yeast form inside the macrophage. Mold form inside the macrophage yeast. Mold, tuberculate conidia. It causes a disease called Darling's disease. It causes a disease called Darling's disease. Typically mimic like tuberculosis. Mimic tuberculosis like hemoptysis, cavity formation, everything is there. Darling's disease, it mimics tuberculosis. And usually resources bat or bird droppings. Bat or bird droppings. Excavation, especially archaeologists, those people. Excavation is a clue. Malassezia furfur, it superficial. Tinea versicolor. Cryptococcus neoformans, it causes pneumonia but not mimic like tuberculosis. Mainly it causes meningitis, those kind of things. So dimorphic fungi present in India. It causes Darling's disease, mimics like tuberculosis, bird or bat droppings. Yeast is inside macrophage. Mold tuberculate conidia. No capsule. It's a misnomer. Histoplasma capsulatum, there is no capsule. Already told. Treatment, mild case itraconazole, severe case amphotericin B as usual. Okay. Yes, my dear. Dr. Deepaki, Ohio River Valley, cave disease, yes, other synonymous, histoplasma. It usually seen in, oh my god, Ohio, Mississippi, Great Lake. Ohio, Mississippi, Great Lake. Even in India, we had a lot of reports, don't worry. Why should go to US to get the disease? It's available in our country, India. You are right, my dear. Next is, what is the main route of transmission of Coccidioides immitis? Coccidioides immitis, which is not in India. It belongs to systemic mycosis. All systemic mycosis, mode of transmission, inhalation. All opportunistic inhalation except Candida. So it is not due to direct contact, inhalation. It causes a disease called desert rheumatism. California fever. California fever. Thank you. California fever. Blood transfusion, usually fungus, not by blood transfusion. Okay, usually. Ingestion of contaminated food, some fungus are there. Aspergilloma, those kind of people, mold. If you keep the bread for a few days, what happened? Bread is full of fungus. Then if you eat, you may get some food poisoning, and I am going to discuss one question is there. Okay, don't worry. Mycotoxins will be there. In corns, rice, rye, oats, everything contaminated with fungus. Okay, it produces mycotoxins. Here, inhalation of spores, Coccidioides immitis. It is a dimorphic fungi. It also dimorphic fungi. Got it? Next is the causative agent of Tinea versicolor is Tinea versicolor. Direct question, my dears. Okay, Tinea versicolor is Malassezia furfur. Tinea versicolor, otherwise called Pityrosis versicolor, Malassezia furfur, which is lipophilic fungi. Which grows in the presence of olive oil. Olive oil. It produces Christmas tree appearance. It produces Christmas tree appearance. Xmas tree, Christmas tree hypopigmented area, and spaghetti meatball appearance. And now one more agent also causing, what is it called? Malassezia globosa. Malassezia globosa is another agent causing this one. Malassezia globosa. It has both hypopigmentation and hyperpigmentation, my dear. Okay, but usually maximum presentation hypopigmentation. Don't worry. Maximum presentation is hypopigmentation. Microsporum canis causes dermatophyte infections. That also causes tinea disease. Okay, trichophyte on dermatophyte. This all causes tinea. Aspergillus causes opportunistic mycosis. Aspergillus produces opportunistic mycosis. Great. Next is, which fungal infection associated with rose gardener's disease? Wow. Rose gardener's disease is nothing but at the time of pruning rose bushes, thorn prick leads the disease. What is it called? Sporotrichosis, caused by Sporotrichia. Sporothrix. It is dimorphic fungi. Yeast is sugar shape. Mold is flower shape. Floret appearance. Ulcers or nodules along the lymphatic drainage. Ulcers and nodules along lymphatic drainage. Yes, ulcers or nodules, lymphatic drainage. Yes, my dear, Christmas tree associated with many conditions, my dear Dr. Deepaki. You see my group, Micromagics group. On the day of Christmas Day, Xmas Day, what I did, all medically related terms in a Christmas tree, in CT scan, in clinical picture, microbiological picture, okay, wherever Christmas tree appearance, Christmas tree comes, okay, all I put together, almost 9 to 10 slides I made. If time permits, just to go to my Micromagic group, you see December 24th or December 25th, in these 2 days, I have made it. Okay. On the day of Holi, I put all colors in Holi. Black death, yellow fever, blue death, black water fever. Like that, all colors wherever, blue pus, green nail syndrome. Like that, white plague. Like that, all colors I made on the day of Holi. Like that, just you can enjoy in the group. Okay. Yes, sir, I have seen. Great, the great Deepki. Good. So, rose gardener disease, ulcers and nodules along lymphatic drainage. Asteroid body is diagnostic. Asteroid body is diagnostic. Asteroid bodies. Like this. Treatment, itraconazole. Treatment, itraconazole. Asteroid bodies, treatment, itraconazole. Got it? Right. Next is, which stain commonly used fungal elements in tissue sections? Among the stains, we are using periodic acid shift stain, that is commonly used stain in tissues. One more is called gomari methenamine silver nitrate. Yes, my dear, right. Splendor Hopley phenomenon. Deepika rightly mentioned. Okay. Gomari methenamine silver nitrate. The commonly used stains. We call it as GMS stain. PAS GMS stains for fungus in tissues. Suppose in case of culture, we are using a stain called LPCB. Lactophenol cotton blue. Lactophenol cotton blue in case of lactophenol cotton blue, we can demonstrate from cultures, not from specimens, only for cultures. Gram stain mainly for bacteria. Some of the fungus also taking gram stain. For example, Cryptococcus and Candida, they may take gram stain, but we are mainly using it for differentiating bacteria, gram positive, gram negative. Z-Nielsen stain mainly for mycobacterial group. And some of the acid fast structures. Giemsa stain in microbiology, we are mainly using for intracellular protozoas and intracellular parasites. Malaria, filaria, babesia, toxoplasma, trypanosoma, those kind of hemoflagellates or hemoparasites, hemoprotozoa, those kind of things we are using Giemsa stain. Got it? Next is spaghetti meatball appearance. Just now I told spaghetti meatball appearance, otherwise called banana and grapes appearance. Like this, yeast with short hyphae. Yeast with short hyphae, we call it as banana grapes appearance or spaghetti meatball appearance. Again, yes, you are right. Malassezia furfur. Candida albicans produces pseudohyphae. Pseudohyphae. Invasive candidiasis, we can demonstrate pseudohyphae. Where Cryptococcus produces capsulated yeast cells. Capsulated budding yeast cells. Capsulated budding yeast cells. Histoplasma capsulatum, already you know that inside the macrophage it forms yeast cells, or in case of culture tuberculate conidia. Conidia. Okay, very good. You are right, Sarin, Dr. Sarin. Deepika already firing. Okay, no problem. Spaghetti meatball appearance in KOH mount. You can think of Malassezia furfur. Next is, which antifungal drug binds to ergosterol and creates pores in the fungal membrane? You must know about the antifungal drugs and mechanism of action. Okay, the fluconazole, what happens? Fluconazole inhibit ergosterol synthesis. Alpha methylase 1,3 alpha methylase enzyme, it acts on. Terbinafine also inhibit ergosterol synthesis. These two people inhibit ergosterol synthesis. Grisofelvin, it disturbs microtubules. Microtubules disruption. The drug which make hole pour on the ergosterol is amphotericin B, one more called nystatin. They make pour in ergosterol. Some drugs like capsofungin, those kind of people inhibit cell wall synthesis. Cell wall synthesis, echinocandins, capsofungins, these people cell wall synthesis. They that inhibit chitin and glucan synthesis. Okay, and flucytosine acts by DNA synthesis. All azoles, fluconazole, clatrimazole, meconazole, econazole, and terbinafine inhibit ergosterol synthesis, where ampho B and nystatin making pour into the ergosterol. This is ergosterol business. Capsofungins and echinocandins acting on cell wall. Grisofelvin, microtubules disruption. Flucytosine, DNA synthesis. That's all. That's all. Yes, you're right, Deepki. Today you joined my new channel. Just before the class I have started on Telegram channel, because many people say discussion, pictures, everything comes means we are not able to see. So I am segregating one channel exclusive for quiz. If you go to Micromagic's quiz, you can see only questions. Try to answer now itself. Even though I am second year, don't need. You need to prepare from day one itself. When you start your MBBS, the day one itself, you are a NEET PG candidate. Okay, if you read now itself, then the final year and after that, it's a cakewalk for you. Easily you can get. Otherwise, that day you need to do everything. Anyway, you need to daily eat little. You can eat much. Beautifully, you can digest. One day if you eat like this, difficult. Okay. Hope you people understand. Now I have started one more channel exclusive for my flashcards. Micromagic's flashcards. Okay. Right. Lovely cup. This is my wife's cup. She will scold. Pharmacologist, no. My cup is hubby. And for my son and prince, some good things. Happy. I didn't notice. Thank you, my dear. Which of the following fungi most commonly associated with fungal ball in lungs? Fungal ball, otherwise called Aspergilloma. Because in the pre-existing TB cavity, this Aspergillus, especially fumigators and flavors, those people, they go and settle, they form Aspergilloma, otherwise called fungal ball. It is septate typhae with dichotomous branching, 45 degree, acute angle branching. Acute angle branching. Fungal ball in lung. They causes ABPA, allergic, broncho, pulmonary. Yes, after TB, pulmonary aspergillosis. Allergic, broncho, pulmonary aspergillosis. Allergic, broncho, pulmonary aspergillosis. Allergic, broncho, pulmonary aspergillosis. Got it? ABPA. Cryptococcus gatti, usually it causes meningitis, immunocompetent. Blastomyces causes a disease called blastomycosis. Paracoccidioides mycosis, it causes Lutz mycosis, otherwise called South American blastomycosis. It causes Lutz mycosis or South American blastomycosis. Got it? Next is, which of the following is thermally dimorphic fungi? So what is the mnemonic for thermally dimorphic fungi? It's my mnemonic STS. One is systemic mycosis. Yes, systemic mycosis, which includes Histoplasma, Blastomyces, Coccidioides, Paracoccidioides. Another fellow is Talaromyces, previously called Penicillium orniffi. Now we call it as Talaromyces orniffi. And do not forget Sporothrix. STS. These people are thermally dimorphic fungi. They are in 25-degree mold form in environment. 37-degree yeast form, 25-degree mold form in environment, 37-degree yeast form in tissues. Okay, these people, STS, these are all thermally dimorphic fungi. Now you can see thermally dimorphic Histoplasma, yes, not Trichophyton, not Aspergillus, not Candida. Candida is a sort of dimorphic fungi, but not thermally, So thermally dimorphic fungi, Histoplasma, see the mnemonic, systemic mycosis, Talaromyces and Sporothrix. Histoplasma comes under systemic mycosis. Got it? Next is got it? Right. Next is the major virulent factor of Cryptococcus neoformans is, okay, major virulent factor for Cryptococcus neoformans is, what is it? Cryptococcus neoformans, the major virulent factor is polysaccharide capsule. Another virulent factor is melanin pigment. And one more is urease. So these are all the virulent factors of Cryptococcus neoformans. But number one is polysaccharide capsule. It won't produce hyphae, no keratinase. Urease maybe, but important is capsule, polysaccharide capsule. It is basically antiphagocytic in nature. Antiphagocytic in nature. Antiphagocytic in nature. Antiphagocytic in nature. Okay. That's all. Antiphagocytic in nature, and it causes meningitis, many things. And treatment, mild case. And what is the culture medium? Many times they ask. Culture medium, one is called bird seed agar and Niger seed agar. Bird seed and Niger seed agar. Bird seed agar, Niger seed agar. It produces brown colonies. Demonstration of melanin pigment, brown colonies. Brown colonies. Okay, brown colonies. Next is Cryptococcus neoformans. Source is pigeon droppings. Source is pigeon droppings. A patient with neutropenia, highest risk of infection with, please remember, neutropenia and hematological malignancy. Neutropenia and hematological malignancy. Always think of Aspergillus. Always think of Aspergillus. Okay. So neutropenia, hematological malignancy, think of Aspergillus. Malassezia is lipophilic fungi. And sporothrixin ki usually Thornbrook, history of Thornbrook is there. Histoplasma capsulatum associated with inhalation of spores. Inhalation of spores, and it mimics tuberculosis. Just now I told. Darling's disease mimics tuberculosis. Histoplasma capsulatum mimics tuberculosis. Okay, Histoplasma capsulatum mimics tuberculosis. Next is the Mickey Mouse or Mariner's wheel appearance in yeast form characteristic of. Already Deepika answered. Okay, see here. It is called mother cell with undivided daughter cell. Look like pilot wheel or Mickey Mouse, or like this. We call it as mariner wheel or pilot wheel or Mickey Mouse appearance. Is diagnostic of Paracoccidioides brasilensis. Paracoccidioides brasilensis, because blastomyces dermatitis is look like figure of 8 broad base budding cell. We call it as snowman appearance or figure of 8 appearance. Snowman, figure of 8 appearance, or broad base budding cell. Broad base budding cell. Coccidioides, it forms spirules. It forms spirules. Endospore filled spirules. Histoplasma, you are aware of that. So Mickey Mouse or mariner wheel appearance in yeast form characteristic feature of Paracoccidioides brasilensis. It causes South American blastomycosis. South American blastomycosis. Okay. Next is, which dermatophyte species is most common cause of athlete's foot? Athlete's foot. Athlete's foot. Athlete's foot called Tinea pedis. Tinea pedis commonly caused by Trichophyton rubrum. Okay, not Aspergillus. Other people may be Microsporum canis, but Microsporum canis not from environment, because this is from environment. Epidermophyton flocosum, it affects skin and nail. Trichophyton rubrum, which has pencil-shaped macroconidia. Like this. And microconidia, single cell, is raindrop appearance. Raindrop appearance or teardrop appearance. Microsporum canis, it has spindle-shaped macroconidia. This fellow, Epidermophyton, it has club-shaped macroconidia. Club-shaped macroconidia. And the causative agent of Madura foot, is mycetoma. Usually mycetoma, most common is, here Madura foot is Madurella mycetomatis. Madura foot is Madurella mycetomatis. Actinomyces also causes actinomycotic mycetoma. Trichophyton, it won't cause mycetoma. It's a subcutaneous infection, which characteristic feature of SSS or GST. What is GST? Tumor, sinus, discharging granules. Tumor, sinus, granules. GST is the mnemonic. So we have two types of mycetoma. One is actinomycotic mycetoma. Another one is eumycotic mycetoma. Actinomycotic and eumycotic. Actinomycotic usually caused by bacteria. Eumycotic usually fungus. Important fungus. I am from the same hometown. I am sitting here in the studio in Madurai. We call it as Madura foot. Madurella mycetomatis. Origin of this disease. Okay, they first found it at Madurai, so called as Madura foot. Got it? Next is, which fungal pathogen can cause opportunistic infection in patients receiving prolonged parenteral nutrition? If the patient who receives prolonged parenteral nutrition, they are more prone to get Candida albicans infection, because all other people mode of transmission inhalation. All other people mode of transmission inhalation. Parenteral nutrition, it's a normal flora of the skin, and many places it enters if not properly, if we're not doing proper antisepsis. Okay, we are introducing catheter related, especially central venous catheter patient, Candida albicans infection is one of the common infection. It is an opportunistic infection. Coccidioides is not in India. Cryptococcus causes usually meningitis by inhalation, all other people inhalation except Candida. Next is, what is the most important risk factor for candidiasis? Candidiasis commonly seen in neutropenia, but we cannot say neutropenia is a risk factor. Diabetes mellitus, these two predisposing factors commonly. Corticosteroid therapy, these are all immunosuppression, where prolonged ICU stay leads to antibiotic therapy. Antibiotic therapy suppresses normal flora. where there is a suppression of normal flora in the skin, intestine, genitals. Okay, there will be overgrowth of candida. Where there is suppression of normal flora, there is overgrowth of candida. Overgrowth of candida. Got it? Next is, so prolonged ICU stay leads to antibiotic therapy. Antibiotics kills commensals, so that it facilitates the growth of overgrowth of candida. That's an important risk factor for invasive candidiasis. That is important. Invasive candidiasis. How to identify invasive candidiasis? Presence of pseudohyphae. Presence of pseudohyphae. Good. Which dimorphic fungus endemic in southwestern USA and causes San Joaquin Valley fever, which is not in India? San Joaquin Valley fever is caused by Coccidioides immitis. It is caused by Coccidioides immitis. It is basically dimorphic fungi. It causes desert rheumatism, already told. Yeast is like this. Inside the spirule, we have endospore. Endospore in the spirule. Suppose if you see the mold, they are like chain-like structure. That's called arthroconidia. Arthroconidia. Chain-like structure, arthroconidia. Arthroconidia. Chain-like structure, arthroconidia. Got it? Arthroconidia. Which of the following fungi produces aflatoxin? Aflatoxin is a mycotoxin produced by Aspergillus flavus. Aspergillus flavus. Basically, it is a hepatotoxin, liver toxin. Basically, it is a hepatotoxin, liver toxin. Aspergillus flavus, aflatoxin, commonly seen in what's called rice, oats, corn, many food items, corns, oats, those kind of things. Rye, aflatoxin. Got it? Majority of the toxins produced by fusarium. Majority of the toxins, mycotoxins produced by fusarium. Aflatoxin produced by Aspergillus flavus. Next is starburst pattern in India ink. In India ink, we have starburst pattern or soap bubble appearance. Soap bubble or starburst. Soap bubble or starburst pattern seen in Cryptococcus neoformans. Important pathogen, important fungal pathogen, Cryptococcus neoformans. Got it? Aspergillus niger, it produces black color. All other people, they won't positive for India ink. India ink, only fungus is Cryptococcus neoformans. It causes meningitis, many things. Blastomyces, figure of eight appearance. Histoplasma inside the macrophage, yeast, those kind of things. You people are aware of that. Next is most common agent of Tinea capitis in children. Tinea capitis in children, most common causes Trichophyton tonsurans. Because epidermophyton, it won't affect hair. Microsporum canis, it is from the kittens. When the person is contact with animals, it's a zoophilic. It affects hair and skin. Okay, common agent of tinea, because trichophyton, it affects skin, hair and nail. In children is Trichophyton tonsurans. Yes, you are right. Which fungus is commonly linked with otomycosis, ear infection? Otomycosis and keratomycosis. Okay, black, you can get black fungus in the ear is Aspergillus niger. Aspergillus niger, it causes otomycosis and keratomycosis. Especially otomycosis by Aspergillus niger, you can see black fungus, black material in the ear. You can get black fungal material in the ear. Okay, Candida auris, it's white color. Microsporum, these people, they won't cause ear infection. Microsporum sporothrix, they won't cause ear infection. So Aspergillus niger, which is black in color. Got it? Next is causative agent of chromoblastomycosis. Chromoblastomycosis is a subcutaneous fungal infection. Subcutaneous fungal infection. It is caused by a group of fungi. Cladospora, Phylophora, Claudophylophora, Malassezia, like group of fungus causing. And classical picture, it produces a typical brown color structure. What is it called? Can anyone tell? What is the brown color? Copper penny bodies. Copper penny bodies. It produces typical copper penny bodies, otherwise called medullary bodies. Or muriform bodies. Copper penny bodies, medullary bodies, muriform bodies. One more name, sclerotic bodies. It produces typical cauliflower-like growth, wart or cauliflower-like growth. What are cauliflower-like growth? Got it? So see carefully. So it's caused by chromoblastomycosis, Malassezia pedrosi. Sporothrix ki causes rose gordonous disease. The name of the disease, rose gordonous disease. Malassezia fur causes Tinea versicolor. And Trichophyton causes dermatophytosis. Tinea. Tinea capitis, Tinea pedis, those kind of infections. So with this we completed our mycology, almost all the aspects from drugs, general mycology, systemic, opportunistic, superficial, everything, cutaneous, okay, all kind of mycology, all kind of questions we have discussed. Now the time is 7:56, 4 minutes before I have completed the session. I will give 3 minutes time to you. Whatever doubt you just post in the chat box, I will answer all the queries. Whatever doubt you have, you can put it in the chat box. I'm ready to answer. Okay, there is no doubt. I'm closing the session just 2 minutes earlier than the scheduled time. Thank you very much. Any doubt, you can contact me in the group, you can mail me. Okay, right.